Good evening, ladies and gentlemen. Thank you for inviting me. It was an honor and a pleasure, and I'd like to thank Dr. Patoulis and Mr. Mamalakis for embracing our effort of QLS in Thessaloniki. I'm here to introduce you to another aspect of medical tourism, which is the medical nutrition tourism. And the QLS is devoted to bridge the gap between medicine and nutrition by restoring the metabolic balance through nutrition and do that in a way that people learn by experience what to eat to restore their metabolic balance. Why in Greece? It was explained many times today, and now we try to emphasize the importance of the Mediterranean diet, which is recognized as the intangible cultural heritage of community. About 6 years ago, there was an editorial in New York Times on an amazing story of a Greek-American man who was diagnosed with lung cancer and was given 9 months to live. Then he decided to go back to Greece, to the island of Ikaria, to be buried next to his parents. But soon after that, he felt better, and he managed to live up to the age of 103 years. It was emphasized in that article the importance of the diet in this area, composed of vegetables, a lot of vegetables, whole grains, olives and olive oil, and little fish, little goat meat, and 70 different types of grasses and herbs that had tenfold increase of antioxidants that we claim there are in green tea and in wine. Unfortunately, this is the picture of the civilized world, the civilized man, with obesity, and that is not adequately being explained by genes alone, because the dog in this picture is also obese. So obesity started in the United States, and along with diabetes, was spread in the rest of the world and becoming an epidemic, and pandemic actually, with bad global projections for the year 2025, 324 million people will be diabetics, and most importantly, the pre-diabetics will be 472 million. So we're focusing on the metabolic syndrome, which is associated with many diseases, cardiovascular, type 2 diabetes, and certain cancers. And the list is growing longer and longer for diseases that are associated with obesity. So as the phenotype is changing at early age, and it is becoming a very active organ, endocrine organ, secreting over 60 hormones affecting every single organ system and leading to many chronic diseases with inflammation as a major mechanism that is called the secret killer of all chronic diseases. So the components of cellular stress are the metabolic, the oxidative, and the inflammatory, and we focusing on the metabolic component, which is associated directly with the glycemic index of foods and promotes either balance or the metabolic imbalance, which is called insulin resistance. And it is insulin resistance which is triggered in animals that they're going into hibernation. But although bears are ready to wake up in the spring, switching from insulin resistant to insulin sensitivity, most of people are staying in this condition forever, and QLS is created to make a wake-up call for this condition. And the question is it possible to be done in a short period of time? We're calling the patients, international patients, to come for 2 or 3 weeks. And recent studies prove that that can be done in a very short period of time. In this study, in 9 days in obese kids, that they changed just one component, sugar, the consumption of sugar, from 28 to 10% of the daily energy intake. And that's now we're starting a sugar campaign to reduce sugar because it's everywhere. And we're taking 3 times more sugar starting from the very early age. And in the Mediterranean diet, sugar and sweets are on the top of the pyramid. We're taking into consideration other important aspects of our diet, of the traditional Mediterranean diet, omega-3 fatty acids, antioxidants, many components that they have anti-cancer properties, antioxidant properties, antimicrobial and anti-diabetic properties. So QLS is targeting metabolic stress, metabolic pressure, as Dr. Tsoukalas mentioned just before to us. And then the diseases that we're focusing we're targeting metabolic syndrome, obesity, diabetes, cardiovascular diseases, cancer, neurodegenerative diseases, autoimmune diseases, and infertility. So we offer thorough evaluation and understanding of the current state of patients' health. We're going into depth information to give by experience, as I told you before, what to eat, how to eat it, how to prepare their meals, and then we give recommendations for specific supplements or low glycemic eaters, snacks and meals, and we give them practical solutions for everyday nutritional needs. And we do that in luxury hotels in Thessaloniki and northern Greece. And we're affiliated with very well-known hospitals like St. Luke's Hospital in Thessaloniki, and we try to support positive health, of the positive concept of health of Hippocratic that requires a knowledge of man's primary constitution, which today we call genetics, and of the powers of various foods, both these natural to them and those resulting from human skills, the processed food. So this along with exercise will keep people away from diseases. So, in the summary, QLS is there for a wake-up call to make a metabolic reset and reprogramming of metabolism out of hibernation forever. Thank you for your